The condition he wrote about was known throughout the world as Kanner syndrome. That Kanner and Asperger made a nearly simultaneous discovery is considered a coincidence in most historical accounts. But Silberman argues that Kanner likely knew about Asperger's work and that he deliberately withheld credit from Asperger due to differences in how they thought about the syndrome. First, as a medical doctor in Berlin during the 1920s, Kanner was a native speaker of German, and his citations in all his papers show that he was familiar with all of the papers on child psychiatry from that era that were written in German. More importantly, Hans Asperger's primary diagnostician, George Frankl, was brought to America by Kanner through a program to help Jewish medical professionals escape Nazi-conquered lands. Frankl was hired by Kanner to become the psychiatrist pediatrician at the Child Study Home of Maryland, a facility that Kanner had established. Moreover, Frankl's wife was Annie Weiss, the other half of Hansberger's team. Kanner never mentioned Asperger's contributions in his written works. His defenders say that he was simply unaware of it, although the fact that he had such a close working relationship with two essential members of Asperger's team challenges such a claim. Kanner's first ideas were first presented in a 1943 paper titled Autistic Disturbances of Affective Contact. He claimed that the condition he had been observing for 5 years was unique and previously unreported, although there were many publications describing what was then called childhood schizophrenia. Silberman describes how Kanner's view of autism had already diverged radically from the model that Asperger and his colleagues had developed in Vienna. Kanner only focused on childhood, so there could be no autistic adults or adolescents. And rather than offering a concept of autism that incorporated a wide range of functioning with greatly differing manifestations as Asperger had done, Kanner described his patients as a strictly defined, homogeneous group. It appears as if he suppressed individual differences to substantiate his claim of discovering a new syndrome. The effort to portray autistic people as essentially alike has been a stereotype that autistic self-advocates have taken pains to dispel. Sparrow Rose Jones, an autistic author, tells us, "Do not assume that I represent all autistics, because we are as different from one another as non-autistic people are from each other." Even though he's known as the so-called discoverer of autism, Kanner was wrong in most of his assertions about it. For many decades, Kanner argued that autism was monolithic, only present in children, and exceedingly rare. He believed that it was a tragic form of childhood psychosis, akin to schizophrenia, caused by inadequate parenting. 3 years before Kanner wrote his 1943 paper, the Frankls left Baltimore. So with this collaboration no longer intact, Kanner lost contact with Asperger's prescient views about autism. There were two negative consequences when Asperger's view was temporarily lost to history. First, the fact that autism could have a genetic component was eliminated. And two, families were now seen as the cause of autism through the infamous concept of the refrigerator mother. Autism became a source of shame and stigma for families, while the theories of its genesis and family dynamics sent autism research and treatment off in the wrong direction for decades. Kanner considered the obsessions of his child patients merely as a desperate bid for parental affection, rather than legitimate focuses of minds that operated quite differently from typical ones. Kanner's refusal to recognize the genetic component of autism and its spectrum nature, and his claim that it was exceedingly rare, had extraordinarily pernicious effects on autistic people. As late as 1957, Kanner said he'd only seen 150 true cases of autism in his entire career, and that he turned away 9 out of 10 children referred to his office as autistic by other clinicians without confirming an autism diagnosis. Being prevented from having an accurate diagnosis meant that autistic people were denied access to the counseling, educational, financial, and therapeutic support services that would have greatly enhanced their lives. It also left them with no explanation for the constant struggles in employment, dating, friendships, and just simply navigating the chaos of daily life. Bruno Bettelheim was the other central figure in autism at this time. In 1956, he received a $340,000 grant from the Ford Foundation for a 5-year study of autism, amount that's roughly equivalent to $3 million in contemporary dollars. He advocated that bad parenting caused autism and that years of milieu therapy could produce a complete cure. Similar to Kanner, Bettelheim's approach to treating autism was based on a complex web of misconceptions and fabrications that caused parents untold grief. And yet both of them actually offered highly humane treatment to the children in their care, and they thus provided a good alternative to the brutality of most state institutions. Bernard Grimlin was the father of an autistic boy whose 1964 book, Infantile Autism, was instrumental in discrediting the idea that autism was caused by toxic parenting. It's a curious outcome given that Leo Kanner wrote the foreword to his book. Even though he was an outsider to child psychiatry because of his professional training, Grimlin's work firmly established autism as an inborn condition based in genetics and neurology. Grimlin's status as a parent motivated him to establish the National Society for Autistic Children, NSAC, which accomplished many important tasks. It helped to end decades of shame and isolation for families, and it lobbied for legislation based on the principle that all children have the right to an education, including those with developmental disabilities. Grimlin formed an alliance with the psychologist Oliver Lovas to establish a means to train autistic people to become indistinguishable from their peers. He also pushed for a number of ultimately discredited orthomolecular cures, such as special diets, megavitamin supplements, and alternative medicines. Although his role in creating the family advocacy movement was very positive, he wound up diverting the resources generated by this movement into an endless quest for a cure, thus preventing the resources from being used in more beneficial ways. Nevertheless, Grimlin's NSAC helped reframe autism in the minds of professionals from a form of childhood emotional disturbance to an inborn disability that required lifelong care and support. The psychologist Charles Foerster was a strong influence on Lovas's thinking. He believed that autism was a form of early schizophrenia and described research that involved locking an autistic child in a small room every day for a year. The child's tantrums eventually disappeared, which convinced Foerster they were contingent on reinforcement. He proposed that parents made their children more autistic by rewarding tantrums with attention. So he advised them to ignore the child's distress until the tantrums disappeared on their own. In 1961, Lovas opened a clinic for autistic children at UCLA. And in his first year, only one child was referred, so he spent all of his time with her. The girl's name was Beth. Silverman describes Lovas's first investigations with Beth as being like a music appreciation class from hell. And here I'm quoting Silverman. For months, the psychologist and his assistants played children's songs for her on a guitar while reinforcing proper social behavior by smiling and saying, "That's a good girl," whenever she clapped or sang along. Beth was a good girl. Within 2 months, she was clapping her hands in rhythm and joining in rousing choruses of "The Children in the Bus Go Wiggle, Wiggle, Wiggle." The more she was engaged by the music, the less she banged her head on the furniture and flapped her hands. Then the first extinction trial began. This time the experimenters withheld their smiles and praise. At first, she responded to the sudden chill in the air by clapping and singing along even more vigorously. But after more than a week of getting no response, she started beating herself up more than ever. During the acquisition trials, her behavior would improve dramatically. But during the extension trials, she hurt herself so badly that Lovaas aborted the experiment. Lovaas claimed that his relationship with Beth allowed him to see the inner being lurking behind her autistic shell. What he claimed to understand of Beth's motivations and manipulations enraged him. In an interview with Psychology Today, Lovaas said that Beth would only hit steel cabinets, and she'd only hit them on the edge because, you see, she wanted to draw blood. So he reacted automatically, as he would have with one of his own children. And I'm quoting here, "I reached over and cracked her one right on the rear." She stopped hitting herself for about 30 seconds. Then she hit herself once more. At first I thought, God, what have I done? But then I noticed she'd stopped hitting herself. I felt guilty, but I felt great. Then she hit herself again, and I really laid it on her. I let her know that there was no question in my mind that I was going to kill her if she hit herself once more. She hit herself a few times more, but we had the problem licked. Lovaas knew that his so-called treatment was unethical, so he had to describe his work within accepted university guidelines. For this, he turned to the language of behaviorism, which allowed him to frame his abusive punishments as innocent-sounding aversive stimuli. The types of behaviors that Lovaas targeted for punishment expanded to include hand flapping, rocking, spinning, and other forms of self-stimulation. It's important to note that research has shown that Lovaas was completely wrong and that his efforts were actually counterproductive. Research has demonstrated the value of stimming for autistic people. Autistic people stim to reduce anxiety and also simply because it feels good. Harmless forms of self-stimulation like flapping and fidgeting may facilitate learning by freeing up executive functioning resources in the brain that would be otherwise devoted to suppressing them. For Lovaas, however, self-injury, self-stimulation, and echolalia were all of a piece and equally ripe for extinction. After working with Beth, Lovaas worked with 5-year-old twins, Mike and Marty. His use of aversives led him to using a sadistic research design where the punishment was extremely loud sound. This was used to produce pain or fear in the twins as a way of making the adult's presence more meaningful and more rewarding by comparison. When these studies were not effective, he turned to the stronger punishment of electric shock. Metal strips were laid on a floor in a way that they could not be avoided. The shock intensity was set to a level meant to be painful and frightening. The boys were together in a room with the researchers. The researchers would call them over with outstretched arms, and if they didn't come to the researchers within 3 seconds, they would receive an electric shock. If the boys tried to escape a shock in any way other than approaching the experimenter, such as by sitting down or trying to climb onto the window ledge, they would receive a shock. They were being conditioned to approach and embrace the very people that were propagating their abuse. In later designs, the experimenter would say, "Hug me," or "Kiss me," and the boys would get a shock if they did not comply within 3 seconds. Lovaas made no effort to hide his comfort and even his pleasure with inflicting pain, particularly in the use of food and water deprivation as a form of punishment. As Silverman describes, Lovaas put Mike and Marty on a strict behavioristic diet, no food at all, 7 days a week, except the token scraps they could earn by acquiring the ability to perform complex social tasks while pressing a bar to avoid a shock. Water deprivation was also stringently enforced, although he noted that to avoid dehydration, water was available to the boys after 6 p.m. each day. Let me tell you, it's a pleasure to work with a child who is on mild food deprivation, Lovaas told a room full of parents, particularly if he has a history of being a good eater, because that's a child who is truly motivated to learn. highly overstated claims for the effectiveness of treatment characterizes both Lovaas's and Rimland's treatments. In 1987, Lovaas claimed that nearly half the children in his experimental group achieved normal intellectual and educational functioning by being in ABA treatment starting at 3 years old. He convinced the world that autism did not have to be a chronic problem. Although independent researchers have never been able to replicate Lovaas's findings, Rimland still defended him, saying it was natural that as a pioneer he was treated with hostility. Rimland also claimed dramatic results from megavitamin therapy, and his research was equally flawed and not generally accepted.